Manually positioning patients in bed is a leading cause of injuries for caregivers in healthcare. The current soaker pads used for positioning patients in bed do not slide easily on the bedding because of significant friction forces. Soaker, or incontinent pads, are commonly used for this task, but they are often ineffective as they are usually placed under the buttocks, increasing the friction and force required to move the patient. If the soaker pad does not cover the patient's back and shoulders, there is a risk for skin irritation from the friction of repositioning. The sliding sheet has been developed to minimize the risk for musculoskeletal injuries during tasks that require the caregiver to position patients in bed. It has been designed to cover the high-risk areas of the patient's back, from shoulders to hips, in order to reduce the friction forces on the skin during repositioning tasks. The sliding sheet is a draw sheet made from cotton polyester fabric with a low-friction polyester panel underneath. These fabrics were chosen for their breathability, durability, and comfort. The fabric slides easily over bedding, reducing the effort required by caregivers. It also features side panels used to secure the sheet in place when not in use. These sheets should be used with patients requiring assistance with bed mobility, particularly those patients who are heavy or very dependent. Sliding sheets are not meant to replace the use of ceiling lifts. If a ceiling lift is available and is not contraindicated, using the ceiling lift to reposition the patient is the method of choice. Sliding sheets are not intended to be placed under every patient. Mobile patients who can position themselves in bed do not require this sheet. Prior to using a sliding sheet, consider the following. How mobile is the patient in bed? How is the patient's skin integrity? How often does the patient require repositioning in bed? What method is currently used to reposition the patient? What kind of mattress is the patient on? For example, a pressure-relieving specialty mattress? Consider patient skincare needs and staff safety needs. If pressure reduction is a concern, either a soaker transfer pad or a sliding sheet may be used. There are two methods to move the patient up in bed. Place the sheet, slippery blue panel, face down. Position the sheet so that the patient's hips and shoulders are on the sheet. Raise the bed height to upper thigh level, ensuring the brakes are on and the side rails are lowered. Ask the patient to assist by bending the knees if he or she is able. Untuck the ends, traction the sheet by pulling the sheet taut, and use it as you would use a regular draw sheet or pad. Ask the patient to tuck in the chin. Method 1. Use a side-to-side weight shift where caregivers stand at each side of the bed facing each other. Method 2. Use a front-to-back weight shift where caregivers stand at each side of the head of the bed and pull the sheet at a 45-degree angle. When repositioning is complete, smooth out the sliding sheet and tuck the ends securely under the mattress. This will secure it in place and help prevent the patient from sliding back down the bed. To move a patient over in bed, move the patient's legs over first if able. Grasp the sheet and use a front-to-back or high-to-low weight shift to move the patient over. To turn a patient over in bed, grasp the sheet over the patient, keeping elbows tucked in, and use a front-to-back weight shift with the legs. To sit a patient up in bed with a sliding sheet in place, raise the knee gatch first and then raise the head of the bed. The knee gatch will assist the patient to maintain a sitting position. When sitting a patient on the edge of the mattress, be aware that the patient is sitting on a low-friction sliding sheet and the surface may be more slippery than usual. To prevent slipping, Ensure that the sheet is well tucked in under the mattress prior to sitting up, and that the bed height allows the patient's feet to reach the floor. The patient's skin must be observed regularly when using a sliding sheet to ensure skin integrity.